share of new cases each day has been growing in the 77 counties where the restrictions loosened. It was around 5% early on. Today you said it's 20%. Do you have any concern that a greater share of the new cases are happening in those counties?
Well, we're going to continue to watch trends. We're going to continue to be proactive. So we're setting up additional test Iowa sites throughout the state so that we can get in front of it. But really what we're looking at is trends, and we're looking at virus activity. So with the data that we're able to collect, and with Iowans going online and using the assessment, that will give us some insight into maybe where it's happening. Is it in a community? Is it county-wise? Is it a facility? Is it a business? I mean, that allows us to really start to drill in and, again, get in front of it before we see a significant spike. And so we'll continue to look at the data and continue to manage, continue to be proactive in our surveillance testing so that we can identify and look at trends as we move forward. But we're looking at it on a daily basis. Still, the majority by far has been in the 22 counties. A lot of times when it's in a long-term care facility, I mean, they've done just about everything that they can do, and it's just really hard in that setting once it's exposed to contain it, regardless of everything that they've done to really try to prevent it. And so that's not indicative of probably a community spread, but more isolated to the long-term care facility. Would that be appropriate to say that?
Yeah, I think that what we're finding. Yeah. I just think that, what we're finding here in Iowa is the same thing that we've seen in other states, is the virus spreads very quickly and efficiently in settings where people live and work closely together. And so we're seeing that trend, play out in Iowa as well.
Is that what you're saying? That's what's driving that increase in those 77 counties?
We're watching, and that's what we'll be able to tell by the data that we collect. But again, it's in households, it's in congregate settings, it's in manufacturing facilities where people work in close proximity. And so the more that we can identify, and that's why we've been proactive in doing the testing. I mean, we're working with our facilities to partner with them so that they can find out who's testing positive and who's testing negative, so that we can start to isolate them, do the case investigation, get them on a path to recovery, start to look at maybe separating shifts and really helping mitigate and control and manage the spread, and so we can have a better understanding of what the scope of the virus activity is. And so they've been really good partners in helping us really walk through that, so that they have some sense, and so their employees have some sense of confidence. Because, again, the statistics show that 80% of Iowans will just have no or mild symptoms, much like flu. It's the 20% that we really need to be focused on, and those are older adults and those with underlying conditions. And so that helps provide, I think, some confidence to the employees to understand what that looks like in the facility and where they're at as they start to open back up and ramp back up.
Governor, some of